أعوذ بالله من الشيطان اللعين الرجيم بسم الله الرحمن الرحيم. Assalamu alaikum to all the teachers. So wonderful to see. I think this is global. That the ratio of female teachers to men is always like 40:1, which I can see in Mombasa as well. It's so good to finally meet all of you. Before I begin, there's one big problem, that this workshop, when I did it with the madrasa teachers in Nairobi, even 3 hours was not enough. So now, we have 1 hour today, and inshallah 1 hour on Sunday. So I'll do my best to go as quickly as possible. If you find I'm going too fast, please let me know. Us speakers, we have a problem. If we get this bomba, we lose track of time. So please let me know when it's 5 o'clock, somebody please just let me know so we can stop here. Inshallah we'll continue on Sunday. Before I begin, now the thing is I don't know Mombasa Jamaat. If we can do a very quick intro if possible, just like a 10-second intro, maybe name, your position, and if you want to mention your hobby, that would be also nice. Should we start with the gents side? Yes. Should I give you the mic? I don't think it reaches.
Assalamu alaikum. My name is Jaffery. I got 5, 6, 7, 8.
Hobby, PUBG, Fortnite.
Yeah,
More like that.
Assalamu alaikum. My name is Zahra. I think that assistant teacher in Mombasa the next 2 years.
We met in Nairobi.
My name is Husayniyyah. I come from by profession, currently teaching for students.
Now it's already 4:15. If we do a round of introductions here, would you like to do that, or do you want to just skip and do it? Yeah, please come to the point. We're getting late. Okay. Now, before I begin the main presentation, I requested Hanabai to keep us into small groups. There's like 5, 6 per table maybe. How many? 8? The sister here is alone. I don't know. She has been okay. If we can kindly sit maybe in groups of 5, 6, or 7. Okay, so there are a couple of papers and pens that will be passing around. Basically, this is just a small quiz to gauge your knowledge before we start. I am told if you get less than 80%, I don't know teachers Nadia will decrease, I'm not sure. But yeah, please, one per group, please. Can I just know who is the youngest teacher here? Oh, she's the youngest teacher. Okay. And the oldest? Everyone is raising their hand. Okay, mashallah. Nobody wants to be young. Okay. So what I'll do is, just a brief introduction. My name is Imran. I'm a psychiatrist. I completed my medical degree in ACMC, which is in Moshi. I did my internship in Dar es Salaam, and then I went to Hausa for a couple of years in Pune, which I'm continuing online, and I'm currently, I've nearly finished my master's in psychiatry. in Nairobi. So, before we begin, you have papers in front of you, each group. What I would like you to kindly do is, I'm going to read out the question, you just may try the answer. Number one, answer. I think it's true and false, if I'm not mistaken. So, are you ready? Okay, good. I heard no, but it's okay, we'll have to continue. Question number one. Sleep disorders like insomnia are always caused by underlying mental health conditions such as anxiety or depression. You have 10 seconds per question to discuss. Ready? I'll move on. Number two, students who frequently experience stomach aches, headaches, or trouble sleeping may be showing signs of anxiety. I heard someone say maybe. These are the people who are very good with MCQ questions. Yes, maybe showing signs of anxiety. I'll move on. Third question, for double the hadiah. A student with severe ADHD will always display hyperactive behaviors, and these behaviors can be easily identified by teachers. Okay, I'll move on. Mental health disorders in childhood and adolescence often resolve naturally as the individual matures without the need for professional intervention. This one was quite straightforward. Next question. PTSD can develop even if an individual doesn't experience the trauma themselves, as long as they are closely connected to someone who has. Please read the question twice. I'll move on. If a teacher suspects a student may have a mental health issue, they should wait for the student to approach them before making a referral. Also quite straightforward. I'll move on. I think there's a few more. If a student shows behavioral signs of trauma, such as aggression or withdrawal, these behaviors can usually be traced to a specific event or experience. Ready? Number 8. A student's struggle with mental health, such as depression or anxiety, will always result in noticeable changes in academic performance, such as failing grades. Okay, I'll move on. 9. Students who engage in self-harm are typically trying to get attention and do not need serious intervention. They just bring drama. Depends. You have tried it once. Question number 10. A significant and sudden change in a student's behavior, such as becoming unusually quiet or aggressive, is usually a sign of a problem with their mental health or their mental well-being. Okay, I think this is the end of these true and false questions. Now, have you guys heard of If you take 2 truths, 1 lie or something like that, right? Okay, so I've made 2 truths, 1 myth. I want you to identify the myth, meaning the false statement. Okay? There's 3 statements. I want you to identify the false one. You can read it. I won't read it. You tell me, is it 1, 2, or 3? Ten more seconds. Okay, I'm moving to the second slide. There's 7 questions. Here, tell me which is the myth here. Okay, I'm moving on. I don't know if people are writing. I can see most just looking at me. I don't know if you are also writing the answers. The third slide. Next slide. Which is the false statement? Five more seconds. Buster, you are good. Buster, good. Okay. Next slide. Slide. I think there's one more if I'm not mistaken. And I'm moving to the next slide. Give you 15 seconds here. And, oh sorry, this is the last one now. Okay, now we'll come to the end of questions. Now, I would like each group to please choose one representative that will be raising their hands. Yeah? Okay. Okay, I think we have chosen representatives. So 1, 2, 3, 4, 5, 6 groups. Okay, so we have 6 groups. So I would like to see 6 hands raised per question. So question number 1 was, sleep disorders like insomnia are always caused by underlying mental health conditions such as anxiety or depression. How many say true? Please raise your hand. 1, 2, how many say no? Only 1 say no. Sleep disorders are always caused by underlying mental health conditions. Why did this group say no? And you are the only one who is right. Yes. Because insomnia is not always caused by mental health conditions. You could have primary insomnia, secondary, they don't go into details medically, but it's not always caused by underlying mental health conditions. Correct? Okay. So, number 2. Students who frequently experience stomach aches, headaches, or trouble sleeping may be showing signs of anxiety. Who say true? Okay. Who say false? Nobody. So the answer is true. It was quite straightforward. It depends. Anxiety shows differently according to your age group. Usually we think anxiety means palpitations, tremors, sweating, etc. We have like 8 types of anxiety. But it does not necessarily mean that children will also exhibit the same symptoms. Yeah? So I don't know, I don't put anxiety in the slides, but we have a number of anxiety types. For example, generalized anxiety disorders, phobias, those irrational fear of something, phobias of closed spaces, phobias of heights, phobias of animals, etc. They are also a part of anxiety. OCD, obsessive compulsive disorder, which mainly affects women, much more greater than men, is also a type of anxiety, falls under anxiety disorders. And I usually get this question from Nairobi and many other places, is that if I want to keep my house clean, does it mean I have OCD? No. OCD literally means, number one, the first symptom of an OCD is it's an obsession. Meaning, if you don't put this remote here and you go to mosque, you can't listen to majlis because your entire focus is this is not here. It's an obsession, number one. So it restricts you from doing your day-to-day activities. Number two, it is a compulsion, which is why it's called obsessive compulsive disorder. Compulsion meaning in the middle of the night you might be sleeping, dreaming very nicely. Suddenly you wake up just to come and see, did I put it properly or no? I have to put this, otherwise I can't eat, I can't sleep, I can't do anything. This is OCD. Now, after hearing this definition, how many have OCD? Please raise your hands. 1. Good.
And 2.
And 2. And 2. So 2 people have OCD. Okay. Question number 3. A student with severe attention deficit hyperactivity disorder will always display hyperactive behaviors, and these can be easily identified by teachers. How many say true? 1. How many say false? 2. So 2 true. False. 1, 2, 3. That group we don't know. False. Okay. The correct answer is false. There are 3 subtypes of ADHD. I don't want to make this too boring or too medical term, but there is 3 subtypes of ADHD. The first subtype is the hyperactive type. Yeah. The second type is the attention deficit type, and the third type is the mixed type. So you could be in that type of ADHD that you are not hyperactive always. You are just attention deficit. You can't pay attention in class. The student always keeps daydreaming. He's unable to focus. So the answer is false. Number 4. This time, this Mombasa's watch has something. Serious. Even in Mondays, it just goes too fast. Mental health disorders in childhood and adolescence often resolve naturally as the individual matures. True or false? You can shout the answers.
False.
Correct, it is false. They don't often resolve naturally. They need professional intervention. Question number 5. PTSD can develop post-traumatic stress disorder even if an individual doesn't experience the trauma themselves. Is this true or false? Some of you are looking like this. False. Unfortunately, those who say false. How many say true? Raise your hands. Very good, you're all wrong. Sorry, those who say false are right. PTSD does not necessarily affect the person who has experienced the trauma. So for example, you might not be a survivor of, let's say, the 9/11 tragedy. You could witness it. Or on the other hand, you could also have a family member witness it, and you, by looking at their symptoms, you're also getting affected. So there's something called, it's a past-on PTSD, which is very possible. Even, I think in Nairobi a few years ago, I wasn't there, but there was this terrorist attacks on the Westgate Mall, for those who have heard. There are many people whose families, there are certain family members, including our community members, who are in the mall at the time, and their family members also started having symptoms of PTSD, flashbacks, insomnia, because they are reliving the trauma as told by their family member. So it's very possible. So the answer is false. True, sorry. So, sorry, PTSD can develop even if an individual doesn't. Sorry, so this is true. Yeah, this is true. Those who say false are wrong. This is true. My apologies, I misread the question. Imagine I wrote it. If a teacher suspects a student may have an issue, they should wait for the student to approach them. This is a madrasa teacher's workshop. This is true. It's false. If a student shows behavioral signs of trauma, these behaviors can usually be traced to a specific event or experience. True? Good. How many say true? 1, 2, 3, 4, 5. How many say false? Then get ready for the shock of your life. How many say false? Nobody. This is the first question that the entire teachers group got wrong. Do you know what is the difference between grief and depression? Anybody? You know, I hate monologues. I don't like talking alone because then my voice also it cracks. I prefer it to be a discussion. Anyone can tell us the difference between grief and depression? What does it mean when somebody is grieving? It's temporary, that's one difference. They are sad. They can express the emotion. You say both of them, they are saying, in both conditions they are sad, which is right, but what's the difference now? One is taking it too hard. Okay, but you could also have mild depression. Exactly. So the main difference is what, as Mai has mentioned, is when you are grieving, you know exactly why you are grieving. Today if you are crying, why are you crying? My wife left me, my husband hit me. Sorry, these are not the examples I want to give, but for example, I have lost this, I'm bankrupt, my bank balance is decreasing. You know exactly why you are crying. But if I ask you why you are crying, I don't know. Now, this is where sometimes depression, many cases of depression, the individual does not know why they are crying, why they are sad. It is a lot of trace back to childhood abuse and trauma, etc. But many people with depressive disorders are unable to locate and tell you, I am crying for this reason. So, which is why, if a student shows behavioral signs of trauma, you might not be able to trace it back. You might see family very good, there is no domestic violence, the child is not being abused, so what's the problem? So it's not always traced back to a specific event. Next, a student's struggle with mental health will always result in changes in academic performance. Always. Not necessarily. The answer is no, not always. Number 9, students who engage in self-harm are typically trying to get attention. True or false? False. They are not trying to get attention. And they need intervention. 10, a significant and sudden change in a student's behavior is usually a problem with their mental health. True or false? The answer is true. Yes. Sometimes when they have, especially if it is sudden, I don't know if I put depression in one of these slides, but one of the major signs of a depressive disorder is something we call anhedonia. Anhedonia is when somebody loses interest in those activities that they once found pleasurable and enjoyable. This boy comes for football twice a week without missing football. Suddenly he has stopped coming. This girl loves arts and craft, loves to go out with her friends, loves those baraza gatherings. Suddenly she's just at home, she doesn't want to go. Why? It's called anhedonia, one of the first and early symptoms of depression, anhedonia. 2 truths, 1 myth. Which one is a myth from these 3? Number 3 are caused by personal thing, correct. The third one is false, right? Okay. Next one, which one is the myth? The second one, correct. People with mental health conditions are not always violent or unpredictable. Many of them are very sane. In Nairobi, in the clinic, in the psychiatry clinic, we see people who are professors in mathematics. People with PhDs, they come to the clinic. So it's not always the case. The third one, this one, which one is a myth? Therapy is only for people with severe mental illness. Correct, this is false. Even people with mild to moderate illnesses can seek therapy. This one? The first one, people with mental illnesses cannot hold down a job or have successful careers. If that was the case, believe me, 40% of many countries would be jobless. So this is false. This one? First one, especially Indian cultures. Depression, say, what worker feeling? These Indian cultures really they spoil this. Just pray namaz. Baba, yeah, it's true to pray namaz, but now this person is going through something severe. He needs medical intervention. He needs mental health professionals. Many mothers, you sleep, you wake up early, you see, all depression will go away. This one? Number two, correct. Schizophrenia is not caused by bad parenting or childhood trauma. Right? Schizophrenia is genetic. This one? Second one. Mental health disorders are only a problem when they interfere with daily functioning. Correct. So it's not necessarily. Yeah. So the first one can have a genetic compound. It's true. Schizophrenia has a genetic component to it. Yeah. Even ADHD and others. Therapy and medication can help individuals manage mental health disorders, but there's no single cure for many conditions. This is also true. So the fourth one is the middle. Now, Inna Lillah 437. These are just questions. We are not even starting the slides. Okay. Now, I'll do something called hypersonic speed movement. Okay? Going to be very, very supersonic. If you move your attention here and there, bas khalas. Okay, so let us do this, let us try. So then in 20 minutes we are done with the next, I think, 97 slides. It's right, I don't know how many slides there are. Definition exposure, why this is a big deal? Because mental health, I'm joking, no. I won't go like this. Mental health is important because the amount of time spent in school and madrasa is significant compared to other institutions. Okay? I'll just do the important ones. Look at this, CDC, the Center of Disease Control, they did a risk surveillance data for the youth from 2009 to 2019, so over a span of 10 years. They found, does this have a pointer? Master is rich, mashallah. Okay. They found that more than 1 in 3 high school students had experienced persistent feelings of sadness or hopelessness in 2019, which was a 40% jump compared to 2009. They also found that students, this is for the youth, students had a 44% increase in suicidal ideations, or suicidal thoughts, or suicidal attempts since 2009. So in 10 years, there was a 44% jump in students, which is why to talk about this is important. There's a lot of stigma surrounding mental health, discrimination, prejudice, etc., etc. Students feel, a question, why do students not ask for help? They feel ashamed to seek help. They fear they'll be judged or labeled. This person, in Umangaj Barabanati, for example, right? Even people right now, some of them in the beginning, they were scared of being seen with me in public, because if somebody sees them talking to me, they got a problem. So that's why he's talking to a psychiatrist. So there's a lot of stigma, which now I think is getting better somehow. They fear judgment. They want to avoid being seen as weak or indifferent, which is why they don't seek help. And then there's cultural factors as well. Mental health, discussing mental health is taboo, or for example, leading to denial or suppression of mental health issues, especially in men. Do you know that research has shown that men and women they suffer depression the same amount. But who comes and seeks help? Women, not men. Men feel, oh, I'm not sick. That's the problem. There's this denial or cultural thing to say that if I'm a man, how can I go to the doctor and say I have depression? It doesn't suit my manliness or something, you know? So which is why men don't come and seek help. However, women, on the other hand, they do. Even with GBV, currently one of my theses is gender-based violence. against women. Many people who are assaulted, many of them do not go and seek help because of the same reasons as well. Fear, being ashamed, fear of being judged, etc. So the data that we have in Kenya of the number of women who are being harassed and assaulted is actually just 40%. Because majority of women do not come and seek help. Okay. Very quickly, there are different terminologies when it comes to mental health. Anyone has done or is doing psychology? Please raise your hands. Anyone? Or has done a bit in school or some courses? Okay, 1, 2, 3, 4, 5. On the gen side, not really announced. A little bit. Okay. So, how many of you know somebody in your family or your friend circle who is suffering from a mental health condition? 1, 2, 3, 4, 5, 6, 7, 8, 9. Okay, there's quite a number of you. Anyone? These are the two main differences. Because of time, I'll skip the others. What's the difference between a psychologist and a psychiatrist? Anyone? Yes, sir. That is true, that is very correct. Psychiatrists are medical doctors. So to be a psychiatrist, you first have to have a medical degree, and then you specialize, just like doctors can specialize in surgery, they can specialize in pediatrics, in dermatology, in radiology. Psychiatry is one of those masters of medicine. So psychiatrists, we can prescribe medications, antidepressants, antipsychotics, injectables, etc. Psychologists are people who have done psychology, they can do talk therapy. So basically they'll talk to you and they'll try to give you coping mechanisms. For example, for your anxiety, they'll teach you breathing techniques and breathing exercises, etc. So psychologists are the ones who do counseling. Many people don't know the difference. So they call me, can you counsel my child? Can you talk to him for 2 hours? I said, I can't talk to my wife for 2 hours. You want me to talk to somebody else? It's not making sense. So this is the difference between psychologists and psychiatrists. Okay. Now, these are some of the warning signs that as teachers, if you notice in a student, it can lead you or warrant you to say that this child or student might need help. When the child or the student has persistent sadness, withdrawing or avoiding social environments and social gatherings, hurting oneself or talking about harm, extreme mood changes, extreme. This boy or this girl was very quiet, suddenly now he's fighting with everybody. Or this, on the other hand, this person is usually very active, very hyper. Suddenly he's the most quiet person in class. What's going on? There's a problem. Drastic changes in mood or behavior. Changes in eating habits. Either they eat a lot or they stop eating altogether. Yeah? Either they binge eat or they starve themselves. Loss of weight or even too drastic gaining weight over a short time. That's also a symptom. Difficulty sleeping, insomnia or too much sleeping, hypersomnia. Both of them can be a sign that this person is going through something. Frequent headaches or stomach aches. Children who witness domestic violence at home, you will find this is a very common symptom. Children who witness, for example, their fathers beating their mothers at home or abusing the mothers at home, they will always in school, today head is paining, tomorrow stomach is paining, Thursday this is paining, they just want to go home. Because they are worried, is my mom okay or not? I have seen this several times. Difficulty concentrating, suddenly they can't concentrate, or from before they are unable to focus in class. You are talking to them, they see the words coming out of your mouth, but they are not concentrating. Changes in academic performance, always an A-star student. Suddenly, there's a decline in grades. Why? What's going on? Avoiding or missing school. These are some of them might be minor, but they really make a difference. Causes of mental health conditions. These are not I'll just go very quickly. Childhood abuse, pressure to succeed, especially again, some cultures. You don't come first, we take you out of the house, I don't know, we cut your legs, etc. Pressure to succeed. Social media. Since the advent of social media, there has been a lot of mental health conditions. If you were to ask me why in 2008 and 2025 the graph is like this for mental health conditions, one answer if you ask from me is social media. And we'll come to it, we'll discuss social media. I think there's another session with the youth, I think, right? Tomorrow night, that's our topic, right? Social media. I think for the ladies as well on Monday, I'm not sure, but I think it's a similar topic. So if you listen to this, you don't need to come for the other one. It's the same one. I'll be repeating. We don't have time to make new ones. Okay. Social isolation or loneliness is another cause. Experiencing discrimination or stigma. Poverty. How does poverty lead to mental health conditions? You are too loud. Speak a bit softer, please. I can hear you very loudly, sorry. Stress. Only poor people have stress. Only people who are complexity. What up? Please explain, mashallah. You think by your English. You go to American schools, eh? So explain please about complexity.
Maybe seeing your peers afford things that you can't afford.
Correct.
Yes. And bringing that complexity that you are inferior to them.
Correct.
I would want you to, lead to basically
Correct.
sadness or depression.
True.
That
True.
I don't like my parents because they can't afford this for me.
True. True. Correct. That's very true. What other reasons can there be if you with poverty and mental health? Yes.
Lack of self-esteem.
Lack of self-esteem, that is correct. Anything else? I mentioned GBV, right? Gender-based violence. Where do you think most of these assaults take place? In secure areas or in areas that are poor? In areas that are more poverty has really struck them. These are the places where we find. So there's a link. There are research papers as well that have been published that show the link between poverty and mental health conditions. Bereavement, sometimes extreme grief can also be a cause. Severe or long-term stress, chronic physical condition, cancers, oncological conditions can take a toll. Drug abuse, this one is now getting very, very common among the youth, this one. Extremely, extremely common. Maybe one of the youth sessions we can also very informally discuss this because this is getting out of hand now. Especially injectables. In Kenya, in Tanzania, the amount of drugs that are available easily and cheap, you won't believe it. I mean, you guys know what I'm talking about, yeah? Experience, okay. Physical causes, there are certain conditions that can cause. Genetics also can predispose you. Now, I usually, see, the thing is, these workshops are very lengthy. 450. I usually keep these type of questions, but we'll have to skip these discussions now. Let's come to self-injury. Now, how many of you know? Yes. You started at 4:15. Even if we started at 4:45, we'll still not finish. I can guarantee you that. But inshallah, if we do finish, I'll come back to these questions. We'll discuss them. How many of you have heard of somebody seen, witnessed self-injury marks? 1, 2, 3, 4, 5, 6, 7. Wow. 14, 16. There's like 17 people have witnessed, heard of somebody or any other person with self-injury marks. Is it more common in men, boys or girls? Girls. Okay. Boys. Boys. Okay. There's no third gender, there's one of the two now. The answer can only be one of the two. So, because I heard girls and then boys, and I'm waiting for somebody else to say a third gender. Those who say boys, please raise your hands. 1. A bit higher. I got 1, 2, 3, 4, 5. Okay. How many say girls? 1, 2, 3, 4, 5. Why do you say it's boys for those who say boys, and why do you think it's girls for those who say girls? Because you have witnessed a boy. Okay, that's a valid answer. Yes, ma'am. Oh, self-harm. Okay, you guys have also seen movies? Astaghfirullah. Yeah, good. I've also seen those movies. they self-harm. I'm just joking. Anyone else? Why you have said it's boys or girls? Yes.
Because men being less expressive and talking things out, unlike girls, tend to resort to self-harm.
One more time, say it.
Men, because they don't express themselves, tend to resort to self-harm rather than girls who talk it out.
That's a very good way of looking at it. I can see some people disagree with you. There are some sisters here who are disagreeing with you. Anyways, any other answers as to why you say boys or girls, and then we come look at the research. Yes.
Boys have a lot of emotions and they don't find someone they're able to talk to. That's why they end up self-harming themselves.
Did you hear her answer? No. Repeat one more time because I want them to listen to your answer when we move forward.
Girls have a lot of emotions and if they do not find someone who they can express it to and talk to someone, then they end up self-harming themselves.
Okay. Thank you so much for your answers. But now let's see. First important point to note, self-harm is not the same as suicide. Okay? This is important to note. The act of self-injury, the aim, the objective is not to kill themselves. It's rather to simply injure one's body intentionally as a way to experience relief from frustration, from stress. No, anorexia and bulimia are eating disorders. No, this is self-harm. Anorexia and bulimia, one of them, anorexia nervosa, bulimia nervosa, one of them they starve, the other one they binge eat and they forcefully vomit. So these are two different things. These are eating disorders, yeah? So, the act of self-injury, remember, is not to kill themselves. It's an act to vent out. Now, it's a coping mechanism that young people and young students use to alleviate tension or stress, and it is meant as a release of a de-stressor. It's meant to make them feel more calm. It's synonymous or equivalent to, let's say, going to the gym or carrying weights. For them, self-harm gives them a sense of relief from the stress they have. However, many people who self-injure quickly experience feelings of guilt and shame, which results in the return of emotional struggles. You see, it's a Venn diagram now, it's a circle. They self-injure to get away from the guilt and shame. After they self-injure, they feel guilt and shame, which leads them to self-injure even more, and this is a vicious cycle which continues. Again, the intent is not to kill oneself. I need to make this very clear. I don't know why I repeated, maybe I was tired. Each individual will choose a different way to harm themselves for a relief. For example, cutting, scratching, burning, carving skin, self-hitting, skin piercing, etc., etc. And many people choose to self-injure specific parts of the body such as the arms, legs, or front torso. In our communities, it's very difficult to notice girls. Why? Because where do they self-injure? Areas where they are covered with hijab. So it's difficult for teachers to come and say, to see if they have self-injury marks. It's difficult. The injuries from self-harm can be difficult to detect as they're not exposed, the areas are not exposed to the public, as I mentioned. It's meant as a coping mechanism, as I say. The exact reasons for self-harm varies from person to person. So for some, it provides relief from stress and anxiety. For others, it is a way to express their emotions outwardly rather than to bottle them up inside. It could even be a reaction to what they believe to be personal failings or faults. My parents are fighting, my parents had a divorce, it's my fault. And I've seen children, because of that reason, have self-harm marks. Now, teenagers and young adults are most at risk for self-injury as the practice usually begins during preteen and teen years. This is the most common age group that self-harm. Certain life aspects put young people at more risk: loneliness, conflicts, peer pressure, having friends who self-injure. They tell you, I'm going through stress, even I used to, but look, I'm touching myself, I feel better. So having friends who self-injure is also a risk factor. Abuse, neglect, mental health issues, use of alcohol, use of drugs, all these are risk factors that predispose them to self-injury. What are the symptoms? scars, for example, emotional instability, presence of sharp objects. There are teachers who have found students with sharp objects in their bags. They have blades and small knives, etc. Long sleeves and pants. You find that children, some of them, the same student who was wearing short clothes, maybe sleeves, is now wearing long sleeves. Why? What's the problem? Reporting of accidental injury. What's happened here? Oh, by mistake, I got cut with a blade yesterday. But be careful, check again after a week. Bite marks, scratches, cuts, loneliness, anger, panic, rejection, guilt, self-hatred. So the question of the millennia, who does it affect more, girls or boys? It affects. Okay, I'll leave this as a homework. Please go and look into it. Inshallah, we have another session on Sunday, isn't it? We will answer that question. You tell me which gender and why. 456. Okay. That's another question we'll skip. Bullying. I think this is also a very, very important subject to be discussed with both teachers and students as well, separately, because this is something that affects everybody, regardless of our culture, our position, our religion, etc. It's something that happens in every school, every madrasa, every institution. Different types of bullying: direct bullying, indirect bullying, cyberbullying, sexual bullying. Now, this is important. Research suggests that children and youth who are bullied over time are more likely to experience depression, anxiety, and low self-esteem. They are most likely to be lonely and want to avoid school. There are certain people at the age of 19, 20, 21 have anxiety, have depression. When you look at them, their life is perfect externally. Financial stability, everything is there. When you trace back 10 years ago, you'll find that they were the most bullied in school. And therefore they are, after a couple of years, this is what they are presenting. The same study showed that children and youth who bully others, now the bullies themselves, the perpetrators, are at higher risk for more intense antisocial behaviors like problems at school, substance use, and aggressive behavior. There was a research done which showed that 60% of substance users in one school were at once bullies and perpetrators. So on the other hand, when you find those who are bullied, they're at a higher risk of anxiety and depression and PTSD, but those who are the initiators are also at risk of antisocial behaviors, personality disorders, like borderline personality disorders, and having substance issue problems. There are many warning signs of bullying, so it's important for teachers and for parents to look into these signs. Unexplainable injuries, lost or destroyed clothing, books, electronics, jewelry. Where's your book? Oh, it got lost. Where's your pen? Next week your pen is lost. Next week this is lost. What's going on? It's a sign to think about. Frequent headaches, again similar to the domestic violence symptoms. Changes in eating habits. Students may come home from school hungry because they did not eat lunch. Why? It was taken away from them. So they come back home hungry. Difficulty sleeping, nightmares, declining grades, not wanting to go to school, sudden loss of friends or avoidance of certain situations. Yeah, you find people who are bullied when they see it's canteen time, all the boys are gathered in the canteen, they'll wait until everybody moves, when it is safe for them, there's no one, and then they'll go. It could be a symptom that this child is getting bullied. Self-destructive behaviors, running away from home, harming themselves, talking about suicide. So bullying can also cause self-harm. You know the self-injury we talked about? One of the causes can also be bullying. Question: why don't kids ask for help? If bullying is so bad, people are taking your lunch, people are taking your instruments, they are disrespecting you, why don't they ask for help? And this could be anyone from the ages of 12 to 18, anybody. Sorry? Fear of? They'll get bullied more. So fear of. Correct. So fear of, number one, not being believed or being judged, and fear of being bullied even more by the bullies. That's true. Any other reason? They don't know whom to ask. It's a possibility. Any other reason? Because yes? They'll be dismissed. Could be possible. Any other reason? There's one answer I'm looking for. This is very common, especially in boys. Especially why boys don't ask for help. Yes. Yes, it's a sign of weakness. Majority of boys who are getting bullied, you know that, okay. They do not ask for help because it is a sign, it shows a sign of weakness. 80% of boys who are getting bullied do not report it for this reason. It's a sign of weakness. What will others think of me? What will my parents think of me? That they're such a weak child. That's why they don't ask for help. Statistics from 2018 indicators of school crime and safety showed that only how many percent of bullying was reported? 20% only was reported. Kids don't tell adults for many reasons. It makes a child feel helpless. They want to handle it on their own, feel in control. They may fear being seen as weak. They may fear backlash, as by saying from the kid who bullied them. Bullying can be a humiliating experience. Yeah? Kids don't want adults to know what is being said about them, whether it's true or false. Oh, but they are saying this about me. Then the father will say, oh, they are saying this, but it's true. They don't want their parents to know what the other bullies are saying about them. They may also fear the adults will judge them or punish them for being weak or just look at them differently. Kids who are bullied may already feel socially isolated. They may feel like no one cares, no one understands them. Kids may fear being rejected by their peers. This is also important. Friends can help protect kids from bullying, and kids can fear losing this support. If I have a few friends, if I'm going to mention or going to complain, I might lose them as well. I might be rejected by my peers as well. Now, why is this important? It's important because there are children who are bullied. Initially, you will find, okay, they've lost their books, they've lost this, they've done this, but it can cause irreversible mental health conditions and trauma for those people who are bullied. If they are afraid to enter the cafeteria, I say they may come home hungry. Bullies, on the other hand, may become more aggressive. Their friends may include other bullies. And bullying behavior may be a mechanism to cope with stress or abuse in their life. Therefore, it is important. Should we do at least one more, or do we stop here? One more quick one? You don't sound very convincing. One more, okay. Zahra. We move to one more. We finish with domestic violence. This is also a very important subject, a very important topic. It's obviously very upsetting for a child to see one of his parents being attacked or abused. From the two parents, who is abused more? The mother. But that doesn't mean the father cannot be abused. There are instances where the father is also abused. But most of the time, it's the women who are abused. Younger children, when students witness domestic violence at home, it depends on their age how they react. So for example, younger children may become anxious, they may complain of tummy aches or start to wet their bed. They may find it difficult to sleep, they have temper tantrums, and they start to behave as if they are much younger than they really are. They start to behave a bit more immaturely. All the children react differently. Boys seem to express their distress much more outwardly. I have given the answer actually of the self-cutting. If you look at this statement carefully, you will have your answer. Boys seem to express their distress much more outwardly, for example, by becoming aggressive and disobedient. Sometimes they start to use violence to try and solve problems, and they copy the behavior they see within the family. So when these boys, they see their fathers, for example, being abusive, they try to mimic that because they think this is normal. So all the boys may want to start using alcohol or drugs, and both of which are a common way to try to block out disturbing experiences and memories. The number of boys who go into substances because of witnessing domestic violence is very high. girls are more likely to keep their distress inside. They may become withdrawn from other people and become anxious or depressed. Question. When a boy witnesses domestic violence at home, and when a girl witnesses domestic violence at home, how do you think they're going to react? So boys become more violent. What about girls? Sorry? They withdraw. When it comes to choosing a spouse, for those girls who have grown up in an environment of domestic violence, what type of spouse do you think they hope for? Somebody who is loving, somebody who is caring. Okay? Anyone else? Yes, Sebastian?
I go for someone who's just like their dad.
We have two different answers now here. One answer from the sister side is that they find somebody who is more loving and more caring, so they do not have to go through the same trauma. From the gent side, I'm hearing that they might try to look for somebody just as aggressive. Now, who is right? Both are right. No?
It varies from person to person.
It varies from person to person.
Yeah.
Let us see. Let us see. They may think badly of themselves. I think you mentioned about eating disorder. Yeah, anorexia, bulimia, and ecopia with witnessing domestic violence. Now, they are more likely to have an eating disorder or to harm themselves. They are also more likely to choose an abusive partner themselves. According to research, it's more 50-50. Either they are going to choose a partner very different from the father, or it's also possible for them to look for a spouse just like the father. Why? Because in their minds, this is normal, exactly. This is expected. This is what every man should be like, which is why they look for an abusive. Yes. Aha, good question. How do boys then, when they grow up, how do boys react? Again, the answer is 50-50. There are other boys who could be a copy of their dads, meaning abusive, alcohol, substance use. On the other hand, there are certain boys who grow up with empathy. And now that I look into the percentage, I'm not sure of the percentage, but I'll look into it, I'll let you know on something else. They know, but you see, the problem is there's something called personality traits. It's very difficult to remove a trait from somebody. Habit is different. Removing a trait is extra difficult. When you are growing up in your subconscious mind, considering this is normal, to remove that from subconscious, very difficult. As much as you know externally this is right and this is wrong. Because habit produces traits. Yes? Correct. So for them, that definition of love or normalcy is this, what they are saying. Children of any age can develop symptoms of what is called PTSD. They get nightmares, flashbacks of the event, become very jumpy. Just some time ago, PTSD is very common, by the way. Somebody comes, and we get so many military people come to the OPD, psychiatry clinic. Military people who one day, for example, they see their friends alive, the next day their friends are dead. They form a bond with them. Many military people from Kenya come, can't sleep, they sleep 40 minutes, and they have flashbacks, nightmares, or even the slightest of movements, and they jump, and they can't sleep. Why? Because they are reliving the trauma. So PTSD is another topic on its own, but children dealing with domestic violence and abuse often do badly at school. Yeah, their frightening experiences at home make it difficult to concentrate, and they are worried about their abused parents. They may even refuse to go to school. I've seen many of them. Children tend to copy the behavior of their parents. Boys learn from their fathers to be violent to women. Girls learn from their mothers that violence is to be accepted, expected and accepted, and something you just have to put up with, which thankfully is changing now. However, children don't always repeat the same pattern when they grow up. This is what we discussed, yeah? Many children don't like what they see and try very hard not to make the same mistakes as their parents, just as the sister had mentioned there. Even so, children from violent and abusive families may grow up feeling anxious and depressed and find it difficult to get on with other people. It is not uncommon for victims of domestic violence and abuse to take a long time to recognize what is happening. Because some of this is generational. My mother endured, now I have to endure. For some families, domestic violence and abuse are a normal part of family structure. Even when children realize that the situation is wrong, shame can make it difficult to speak out. Who do I tell? I tell my chacha, it's the same situation. I tell my uncle, same situation. However, having a trusting relationship outside the home can increase the chances that someone affected by domestic violence and abuse will manage to talk about their experience. I know teachers who are the first-hand people, first aiders basically, who came into and realized that these are the symptoms that this person is going through something, and it was teachers who helped the students. I know a number of cases of children with self-harm, suicidal attempts even with knives. It was the teacher who realized. The first person to know that there is something wrong with this child. Let me take it forward. Let me talk to madrasa management. Let us have a mental health professional assess it. Sharing the secret with someone outside the family is the first step in breaking out of the cycle of violence and abuse. Question: how do we help the children? Number one, by making sure that domestic violence do not remain a shameful secret. This is the first step. The child will never open up as long as he or she feels that this is a shameful secret. And this is now, we'll come, I think on Sunday we'll see the role of teachers generally. What is the role of teachers according to Islam, the Quran and the Hadith, on interacting with one student? For the more serious long-term effects of domestic violence and abuse, parent and child treatments are available, group treatments, individual therapies, etc. And children are better able to cope and recover when they get the right help and support. For example, from other family members, from peers, from the school. And some children find it helpful to speak to a professional. Nowadays, I see many schools have an in-house counselor as well, which is improving. Oh, we finished. Alhamdulillah, we are finished actually. Today's presentation. I want to apologize if we went beyond time. But are there any questions, any queries? Inshallah, in the next session, we shall continue. I think there's 2 more topics that are remaining, or 1 more, before we move into the role of teachers with students. And I also received a few questions, I think 5 questions. You can address them, inshallah, on Sunday. Yeah? So if there are no questions, I want to thank you so much for your time. Sallallahu alaihi wa sallam.